All right, welcome back, everyone. I don't know if you realize this, but April's National Minority Health Month. It's a time really dedicated to raising awareness about the health disparities that continue to affect communities of color all across our country. But I know an expert who's going to help us out. Joining us this morning is Dr. Cindy John, a cardiologist with Vital Heart and Vein, to talk about some of the most pressing heart health challenges facing minority populations and what steps we all can do to take to protect our health. Dr. John, thank you so much for being here.
Good morning.
So explain to people.
Yes.
This is such an important month, not just for for everyone really, when it comes to our health. So why is it you're finding in more minority communities cardiovascular issues and strokes and so much more than maybe in other communities?
So such an important question. So you're absolutely right. So remember, more than lung disease, cancers, car accidents, heart disease is the #1 killer of Houstonians, right? And you also have to understand that as Texans, we're 3.97 higher risk than the national average.
Why is that the case?
So there's so many components that come with that, but a lot of it has to do with our lifestyle and kind of culturally how we view things. So if we look at population data, we can actually see some concerning trends. So for example, Asian American adults more likely to have uncontrolled hypertension, 4 out of 5 patients. When we talk about Hispanic patients, they're 2 times more likely to have diabetes and not even know about it. When we talk about Indian patients, super high risk population for heart attacks, and they tend to have heart attacks 10 to 20 years younger than the rest of population. And Black patients, higher rates of obesity, more likely to have high blood pressure diagnosed at an early age, and unfortunately more likely to have serious complications like heart failure and kidney failure resulting in dialysis.
So what can we do in order to change these numbers? We have the resources.
Yes.
We have the ability to do it. I think the first step is informing people like you're doing,
yes,
but telling them they can do it. So what should step 1 should we do to change these?
Great question. So odds are not in our favor, but change starts today, right? So it has to do with talking to each other, talking to our friends, talking to our family, really making it normal to do things like getting those yearly physicals. Remember, if you have insurance, it's covered to get those yearly labs. You have to know your numbers. And we need to normalize things like taking medications. Oftentimes, we have this cultural stigma of we don't want to be sick, so we don't want to take medications, but we're leaving easily controllable conditions like high blood pressure and high cholesterol untreated, and that's leading to higher risks of heart attacks and strokes. The other thing is there's a lot of cultural norms that we have that we share amongst a lot of minority populations, where we have our great-great-grandmothers who made these incredible recipes.
I knew you were going to get to the food.
Yes,
I knew it was coming.
Tortillas and rice and naan and potatoes and pastas, all these things, right? And we've lovingly passed this on from generation to generation, which is great. It's so wonderful for us to embrace our culture. But when we do these things, we have to remember our predecessors were eating those meals and going out and doing manual labor.
Exactly.
Right?
So they were burning off the calories instead of being sedentary and watching Netflix for 12 hours straight.
Or sitting in front of me too.
Yeah.
But you know, we're eating these delicious foods and then we're sitting in front of a computer all day, right?
Gotcha.
And the other thing is, unfortunately, because they were doing physical labor, exercise wasn't really a thing. And so it's not really a cultural norm for us to do those things, but it's so important. And what we can do as a family is we can choose balance, right? So let's remember to embrace our roots. Let's empower ourselves with information, but then let's choose balance. When we do have those family meals, let's replace some of those options with fruits, salads, maybe some vegetables. Maybe after Saturday brunch, you go with the girls, you go for a walk in the park. After Sunday night family dinner, take a walk with the family. These small changes can actually make a huge difference on how we interact as a community, and it can really impact future generations.
I love the information you're giving. So once again, you can still eat the meals, eat them in moderation, smaller doses, not doses, but you know what I mean. I went into medical terms all of a sudden. The smaller portions, get exercise, get moving, take medications, but also go to vitalheartandvein.com. She's got all you need to know. Also, our website, CW39.com, will give you more information on taking care of your heart so we can reward things like heart attacks, strokes, all of those things that our communities are now seeing. Let's make a change, and you are the beginning of that. I love that. Fantastic job.
Thank you
so much for being here.
So glad to be here. Appreciate that.
And now you're friends of the show, so you're family. So she's going to be back, everybody. Now.